Hey guys, welcome back to another edition of Civil Liberties News. I've been doing quite a bit of digging here lately into the past, and I've come up with some news clips from a long time ago, back in 2003, somewhere in 2009. 2003 was the SARS, 2009 was the H1N1, and I think you guys are going to be pretty fascinated with the evidence that I have that this is not the first time that China has withheld evidence concerning a pandemic. If nothing is done to punish them or shame them in front of the rest of the world, then this is likely not to be. I mean, come on guys, what's their incentive to tell the truth? They've done it multiple times in the past, and I believe that if nothing is done, they will continue to do this. And it's just going to get worse. The diseases are going to get worse. The pandemics are going to be more globalized. You know, this all started out small scale and it's built up to where we're at today, right now. A global shutdown and thousands upon thousands of people losing their life. Take a look at what I've got here, and I'll be right back with you.
February 21st, Hong Kong. A doctor from southern China arrives for a family wedding. Whether he knows it or not, he is sick, carrying a mysterious new virus. He checks into the Metropole Hotel, the 9th floor. And over the next 24 hours, he spreads the virus to at least 12 other hotel guests. The next day, the doctor's condition worsens. He goes to a Hong Kong hospital. But the people he's infected go to Hong Kong's airport. The virus is about to take flight. The Chinese doctor is dead. And soon more than 700 others will die of severe acute respiratory syndrome, SARS.
The WHO has always had a mandate to protect the world against disease, but 3 years ago, after a series of global epidemics, it decided it had to do better. It had to become more proactive. So it set up a new worldwide surveillance program to identify diseases as they emerge and to stop them before they have a chance to spread.
So with all of that at their disposal, how did the WHO not catch SARS before it spread? Their answer, echoed in headlines around the world, was China.
China, say its critics, chose to save face rather than save lives.
China was too secretive, said the WHO. It knew about SARS as early as last November, but didn't share the information.
The Chinese knew about the outbreak, but ordered silence.
As one WHO official put it to the New York Times,
in December and January, it was dead silence from China. That was like, well, I mean, if China had admitted what was going on in, well, I mean, if China had admitted what was going on in,
well, I mean, if China had admitted what was going on
in November or December or January or early February, then presumably that doctor would not have left southern China, and he never would have infected those 12 people in the Metropole Hotel in Hong Kong. So the disease would never have gone to Canada, it never would have gone to Vietnam, it never would have gone to Singapore, it would have gone to a lot of other places that it went.
within weeks, panic. Healthcare systems around the world are in crisis. The virus, still a mystery, has proven deadly.
Does that not all look eerily familiar to what's going on today? When I started doing this research, one thing that I realized going back, even going further back than these recent pandemics that we've had and recent outbreaks, 80% of the world's pandemics start in China. And from what I can tell, they don't seem to be too sorry about not containing it within their borders, or even just telling people what the hell is going on. And yes, their people suffer, but so do the rest of the world. We need to unite as a global force and make China take responsibility for their actions. Take a look at this footage I've got also on how long we've been researching the coronavirus.
The coronavirus is the family that SARS is a part of. So SARS stands for Severe Acute Respiratory Syndrome. And in 2002 and 2003, there was an outbreak of a novel virus in China.
a novel virus in China.
A novel virus in China. A novel virus in China.
In the Guangdong province. And it started out as a severe atypical pneumonia that was diagnosed basically as not having any known other viral component. Usually coronaviruses just give you a cold. What was unusual about SARS is that it was so lethal. And none of the other coronaviruses in humans actually cause such a lethal disease. And during the epidemic, there was around 8,000 people infected, around 800 people dead, so around 10% died from the acute infection from the virus. There was a novel coronavirus that was first reported in September of 2012. It's now called human coronavirus EMC. And what we know is that EMC at the sequence level, it looks like two other known bat viruses that are bat coronaviruses. The parent virus, and the reason that's interesting is that the parent virus of SARS came from bats. And the worry is that this new human coronavirus EMC, which is also from bats, is essentially the very early stages of what we saw for SARS. So this is one of those, this is what we saw where we have very early infections from animals to people. And if the virus accrues these mutations along the way that allows for very high transmissibility, then it becomes a much more problematic public health concern. In my lab, we work on kind of two angles for SARS. So on one angle, we look at the actual virus itself and look at viral proteins that are important for disease. And what we've identified is several proteins that block the innate immune response. We've identified several proteins in SARS that inhibit those innate immune pathways. That initial, very early response to the virus is inhibited in SARS-infected cells. And we've been figuring out what proteins are doing that and how they're doing it. The virus actually induces a very uncontrolled immune response. So instead of having a very steady process-like response to the virus, we get a very uncontrolled immune response where the actual host response to the virus is the thing that damages the lungs and causes death. What we've been able to show is that these proteins from the virus actually become very good drug targets. So several of the proteins, one of the proteins that we're working on is a protease that's important in the virus, and we're using that as in drug screens to identify drugs that when you treat cells or mice with or infected with the virus, we can then treat with the drug as a therapeutic to inhibit the virus. We have a project where we're looking in Maryland, right in our backyard, for viruses that are in bats to see if any of those have the capability of jumping from bats to people. We're working on that project previously, and now it's taking up speed to becoming much more important that there are these other viruses out in the environment that people didn't even know existed before and have been there for much longer than we knew about, that all have the capability of jumping.
Bats, SARS, ARDS, acute respiratory distress syndrome, the coronavirus. Damn, man, that all sounds like what's going on right now, doesn't it? And you guys have been studying this shit since 2003? And you're gonna sit there and brag about how you've been able to figure out the proteins, but you have no treatment for this new coronavirus? You know, that was a novel coronavirus. This is a novel coronavirus. Look, I'm not saying that there's a conspiracy, but does it not seem like this is like the third attempt to get something stronger, more deadly, and spreads faster? I don't know though, you know what I mean? I'm just a regular person. I'm a small business owner. I'm not a scientist. Maybe I'm wrong, but I do have common sense. Check out this other clip I got.
The H1N1 outbreak that started in 2009 and wound down 10 months later was Singapore's last major infectious disease emergency. Now, here's how it panned out. So the World Health Organization first declared the H1N1 infection a public health emergency in April that year after discovering a new virus strain in the US about a month earlier. In Singapore, the Health Ministry took precautionary measures to prepare against the H1N1 outbreak. This included raising an existing disease surveillance system and influenza pandemic preparedness plan called Disease Outbreak Response System, from green to yellow. And when WHO raised its pandemic alert from phase 4 to phase 5 due to the increasing human-to-human spread, Singapore's MOH raised its alert from yellow to orange the same day. MOH then revised the DOORS alert downwards to yellow on 11 May. And at that time, there were no confirmed cases of infection here. The first case of H1N1 in Singapore emerged some 2 weeks later. The patient? A 22-year-old undergraduate who returned from New York on 26th of May. She developed a cough while on the flight, but passed the airport's temperature screening as she did not have a fever. The infection was confirmed by laboratory results that evening, and MOH initiated contact tracing of her close contacts and various measures. Now, as of 23rd June, there were 194 human cases of H1N1 in Singapore. On 18 July, the H1N1 virus claimed its first victim in Singapore, a 49-year-old man with heart problems. He died of a heart attack, which was complicated by severe pneumonia and the H1N1 infection. The virus outbreak appears to peak by August, with attendances at clinics dropping for the first time in weeks. More than 400 family clinics island-wide were made H1N1 ready with various medical supplies, including personal protection equipment and Tamiflu vaccines made available at these pandemic preparedness clinics. The 18th and last H1N1 fatality of the year was in September. A 61-year-old man with a history of diabetes, hypertension, and end-stage renal failure. The doors alert was lowered from yellow to green on 12 February 2010. And by this time, some 415,000 people island-wide had been infected with the virus, with most said to experience mild illness.
Hey guys, so check this out. This is the World Health Organization, and this is the cumulative number of reported probable cases of SARS from 1 November 2002 to 11 July 2003, and it's got a breakdown of, you know, all the months and all the countries and their numbers. I'm just going to scroll down to the bottom, and these are the totals. So total 8,437. Wasn't really that big of a deal. I mean, that's a lot of people it infected, but we're thinking worldwide, right? I mean, it did go worldwide. There just wasn't a lot of cases. 813 deaths and 7,452 recovered. And then we go to the novel H1N1, and this is the CDC, Centers for Disease Control and Prevention, and it reads, during the pandemic, CDC provided estimates of the numbers of 2009 H1N1 cases, hospitalizations, and deaths on 7 different occasions. Final estimates were published in 2011. I bet that we'll probably see that with this new virus as well. A couple of years from now, they'll release the real numbers. These final estimates were that from April 12, 2009 to April 10, 2010, approximately 60.8 million cases. And they give a range from 43.3 to, who knows, 89.3 million, 274,304 hospitalizations, and 12,469 deaths occurred in the United States. 87% of deaths occurred in those 65 years of age, with children and working adults having risk of hospitalization and death 4 to 7 times and 8 to 12 times greater respectively than estimates of impact due to seasonal influenza covering the years 1976 to 2001. In our study, adults 65 years of age or older were found to have rates of hospitalization and death that were up to 75 to 81%, respectively, lower than the seasonal influenza. These results confirm the necessity of a concerted public health response. So yeah, I mean, what did we learn? What did we learn from any of these outbreaks? Obviously, nothing, because here we are again getting caught with our pants down, only this time it's way worse. You know, this pandemic is likely to kill 60,000 people, not 12,000, and it's likely to infect, you know, hundreds of millions. I mean, it's ridiculous. It is ridiculous. It's almost, and again, like I said, guys, I'm not trying to be a conspiracy theorist. I mean, when all the facts point to what all the facts point to, what are you left with? It seems like this was done on purpose. It seems like they've been playing around trying to get it right, and now they've perfected it, and we're just gonna unleash it and see what happens. It's sad. And you know, the saddest part about it is that China has lied in the past, multiple times. They'll lie again. They don't give a shit about anybody, not even their own people. The only thing they care about is not losing face, not looking weak. They're not going to publish the correct numbers. They're not going to share the data. What are we doing, guys? What are we doing? If you enjoyed this video and learned something from it, please leave a like and a comment telling me how you feel about the situation. Give me your idea. I'm kind of curious to see what everybody else thinks about this. Am I crazy? Or do you feel the same way? Thanks for watching, guys. I'll see you in the next video. Have a good one. Bye.